Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Hi, everyone. Welcome to the podcast today. My name is Diana Ferreira. I'm a certified lifestyle medicine physician and a lecturer at the European School of Lifestyle Oncology. I'm also a cancer survivor. And today on the podcast, we have Francesco Betariga, and I'm hoping I'm pronouncing it well.
Yeah, that's perfect. That's perfect.
All right, good. So Francesco is a PhD candidate at the Exercise Medicine Research Institute in Perth, in Western Australia. Francesco has completed a Bachelor of Science in Physiotherapy and Exercise Physiology at the University of Brescia in Italy, and a Master's of Science in Strength and Conditioning and Exercise Physiology at the Middlesex University in London, UK. He worked as an exercise physiologist in a private clinic where he worked with patients with cancer, lipedema, lymphedema, cardiovascular diseases, metabolic conditions, and musculoskeletal disorders. His current research focused on exercise-induced myokines and their effects on cancer cells in breast cancer survivors. So welcome, Francesco.
Hi, everyone. Thank you so much for inviting me for this podcast. It's a pleasure to be here.
Pleasure. So let's dive in. And I start by asking a fairly broad question, which is always interesting to know. But what captured your attention to the field of exercising oncology? Why do you have an interest in this specific population?
Yeah, that's a good question because I think everyone wants a starting point somewhere to focus on something very specific. So yeah, as you said, I did my bachelor in physiotherapy. So my first aim was to help people with pain. Yeah, most likely were people in pain, like musculoskeletal condition, like low back pain and so on. But I was very fascinated by the field of exercise, generally speaking. So my main focus during the bachelor and during the master was sports rehabilitation, for example. But I understood quickly that through exercise, we can help a huge range of people with condition. So can be cardiovascular disease, can be people with pain, can be, diabetes, obesity. And then it came up that the people with cancer really benefit from exercise, of course, from also other treatment, but from my point of view, also from exercise. This is my field. So, and then I realized my first aim was to help people, right? And I think there is anything bigger to help people that are at risk of mortality, because cancer, unfortunately, can put people at a really high risk of mortality compared to other condition. And so this was the driver for me to say, yeah, I need to help these people more, because I can combine one of my favorite field, like exercise, in a very fragile population, a population that really needs attention. And also it's unfortunately understudied, or at least now it's going better, it's growing, but it is, yes, understudied, or at least, for example, in Europe, we don't prescribe exercise often for patients with cancer. So that was why I started this PhD, and why I started my clinical practice in people with cancer.
Yeah, and that's super interesting. And I was going to ask you if the interest came before you actually were involved in research. So this was previous to your research roles, etc., right? So it was mainly based on experience?
Yes, but I was fascinated by research. So during my master degree, I ran some research in sports rehabilitation, and I'm still doing, because I still love sports rehabilitation and musculoskeletal. But yeah, I wanted to do an experience in research, to also have an experience abroad. So a couple of things went well. So at the end, I came here in Australia a couple of years ago, almost 3 years ago. And then, yes, I do love research. I always love, because even when I was doing my bachelor or master, I was reading papers about, the latest evidence. So then I realized that we can do a lot of things through research, can be very impactful, especially if you have also a clinical eye, because I spent years doing clinics, so I know what can be being a practitioner, a physiotherapist in my case. So yeah, so then yeah, I think it happened like 4 or 5 years ago. I didn't start doing research when I was doing the bachelor. I just started a few years ago, 4 or 5 years ago, and yes, everything is going apparently very well. So yeah,
Yeah.
I'm happy with that.
I think so. You have such interesting research published so far, so we will dive into that in a second. Also a fairly broad question, but something that people with cancer asked a lot in our consultations, which is about the type of exercise they should do. So, and of course, from your research, we know there's different benefits with different types of exercise, but I would love you to dive into these difference in terms of resistant training, aerobic training, etc.
Yeah, I will speak in lay terms so everyone can understand if you agree. So yeah, guidelines recommend to perform both aerobic exercise and resistant exercise for patients with cancer or survivors. It means people after primary cancer treatment. So aerobic exercise is any exercise that involve your cardiorespiratory fitness. So for example, can be cycling or walking if you are too weak. Swimming, running, jogging, any kind of activity that is more aerobic orientated. And generally, the main purpose of these activities, these exercises, to improve your lung, your heart, and maybe reduce body fat. So this kind of benefit. But also the guidelines recommend to do also resistant training, which is the other way, the other end of the spectrum. So resistant training can be done, for example, using dumbbells, barbells, weight machines. So any kind of, let's say, gym activities, gym exercises. And generally, the benefits are more related to increase your muscle strength, your muscle mass, increase maybe lean mass, which is a sort of muscle mass, bone mineral density. And yes, guidelines recommend to do at least 3 days per week of aerobic exercise, let's say around 75 minutes. If you are going to do high intensity exercise, meaning that your efforts is really high, or around 150 minutes at moderate to low intensity exercise. So like a pace that you can keep for longer duration. And this is for the aerobic. For resistance, they recommend to do at least 2 days per week. Of course, it's better to split with some rest between, but 2 days per week at, again, moderate to high intensity. So these are generally the guidelines and what people should do. Of course, these should be tailored on everyone's needs, type of treatment, type of cancer, all these aspects.
Sure. Sure. Thank you so much. And also, would love you to explore. So within the aerobic training, which is this cardiovascular training, which offers cardiovascular benefits, you talked about the high intensity, the moderate intensity. Is there a difference in terms of the impact it has in the body? Is there why should we choose one over the other, and in which circumstances?
Yeah, I mean, generally speaking, so it's a really broad discussion. A combination of both should be good. So if we go with something that is moderate, so we can keep this pace for longer time. So for example, if we go walking or if we go running, but if we are able to run for 20, 30 minutes or cycling, we have some really good benefits for the body, but we have the same benefits when we perform high intensity exercise. So high intensity aerobic exercise means doing maybe shorter bouts of exercise, so shorter time of aerobic exercise, but of course at higher intensity. So can be sprinting, for example, or can be cycling at very high RPM, high intensity. So both are good. So we can't say that one is better than the other. Potentially, it appears that high intensity exercise has greater effects on the cardiovascular system. because of its intensity, because it's higher, and maybe greater effects in reducing body fat. This is just because it's less time consuming compared to the moderate intensity, because with high intensity you just need maybe 20 minutes of session, while for the moderate intensity, of course, to induce some benefits you may need 40-60 minutes per session. So these are the main difference in terms of which one we should prioritize. Both are really good. Let's say that maybe if you are weak, you don't feel very well, you need to start doing something, a moderate intensity, just 20 minutes, for example, and then gradually increase over time can be better. Also to accommodate, for example, the effects of cancer treatment, for example, during chemotherapy or during radiation therapy, where people feel weak and they have nausea, they have this kind of side effects. We need to balance very well the intensity of exercise. So yeah, this more or less is what we do with aerobic exercise.
Okay, great. And tell me something. Is there how do you, when you have an individual person, a person in front of you, how do you, how do you define what's moderate and what's high intensity for that particular person?
Yeah, I mean, there are different scales. There are some objective scales that are more related to clinician. So we can measure, for example, the VO2 max or heart rate max, which is more, let's say, lab oriented. If we want to speak, easily, and we just have a person in front of us, we are in the gym, we don't have any particular equipment. Let's say that you put your patient on if the patient is able to walk or to cycle, you put, for example, on the bicycle. I think it's a good way to start, because you don't have any issue related to the risk of fall, for example. So if we go, for example, on the bicycle, we start at, I don't know, moderate level. You put on the bicycle 5 out of 10, the intensity of the pedals. And then you just ask your patients from 1 to 10, how difficult is this? How long can you keep this pace, or how long can you keep this rhythm? And there are several scales that we can use. They go from 1 to 10, and of course, higher the numbers, higher the efforts. So if a person, let's say after 5 minutes during aerobic activities that should be, let's say, easy for everyone, should be light, tells me like I'm really struggling. For me it's 8 out of 10. This means that for them this is already high intensity. Okay, because maybe it's fragile, overweight, uh, maybe during chemotherapy. So several things. Otherwise, if this person says to me like, it's very easy, it's very light, it's 3 out of 10, I know that this is light intensity, not even moderate. So this means that to the second person, I can give her or him more minutes or more intensity, because I know that they can give, they can give me more. So we can push them. And it's important. Exercise is safe. So we shouldn't be afraid to push patients, because we know that there are benefits if we push above their limits. Of course, we need to follow some recommendation, but we should be very confident because exercise is safe. So yeah, we can push. We should push, actually.
Yeah, to see the benefit and to see actually progression, which makes sense. So, you recently published a very interesting study that I'm talking about your systematic review and meta-analysis examining the association between muscle strength and cardiorespiratory fitness and mortality. And I would just like to speak about this study for a minute. Tell me just first the overall findings in terms of the relationship you found between muscle strength and cardiorespiratory fitness and mortality in this
Yeah,
population.
yeah, we measure, as you said, strength, muscle strength, and cardiorespiratory fitness in people already diagnosed with cancer. And we found that people or patient with cancer, depends how you want to call them, with higher levels of muscle strength or cardiorespiratory fitness had a significant reduced risk of mortality, up to 46%, which is a really huge number. And this was for all-cause mortality, because we know that, unfortunately, people with cancer may die from cancer, but also from other disease, such as cardiovascular disease or any other condition, unfortunately. So this is a really huge number, like up to 46%. Sometimes, some drugs or medication, new medication, we are happy when we find something around 10 to 20% of efficacy. So we are talking about 46%. So it's incredible. So in practical terms, what we want to say is that if you want to increase your muscle strength and cardiorespiratory fitness, you just need to exercise. You just need to train. And this may potentially reduce your risk of mortality because this, as you said, was just an association. So we just see what happened to people with high muscle strength and cardiorespiratory fitness compared to people with low muscle strength and low cardiorespiratory fitness. And those people with high physical fitness, muscle strength and cardiorespiratory fitness had a very reduced risk of mortality. So it's a really important topic that we found.
Yeah, absolutely. And 46%, I mean, the numbers on exercise as a lifestyle pillar in cancer are really amazing. Yeah. And I usually use exactly the same terms you mentioned to talk about it. If it was a pill, I think everyone was completely going crazy about it. So absolutely. So in terms of cancer specific mortality, what was the reduction in your study?
Was around 11 to 18%. So cancer
Okay.
specific mortality is the death for cancer itself. So not for
Right.
other reasons like cardiovascular disease. So unfortunately, because the topic is more difficult to investigate, we couldn't find a lot of studies like for all cause cancer mortality. But the studies we found, again, the observation were the same. So patients with higher levels of strength or cardiorespiratory fitness had a reduced risk of cancer-specific mortality. So this means that, again, exercise is can predict and can protect people from dying from cancer. Again, it's a really amazing. And this is why it should be in the standard care for people with cancer. Exercise should be part of the standard care.
Yeah, absolutely. And exercise physiologists, for example, they're not part of the healthcare system here in Portugal. I'm not sure how it is in Italy, but
Oh yeah, no what? Let's skip
yeah,
this question.
the same. Yeah,
Yeah.
exactly. So that really needs to change. So in terms of still about that study, in terms of differences in between specific cancers, can you tell us a little bit about that? Did you find any difference? And I know these may be complex to respond because the numbers become smaller.
Yeah. Let's try to figure out. So again, this was a review. This means that we included several studies, like for more than 40 studies. There were in total 47,000 patients in this analysis. So we tried to see if when dividing by each cancer, each specific cancer, let's say breast cancer, prostate, brain, etc., we could find again similar results. And unfortunately, we couldn't find results for any type of cancer because most of these studies were with mixed population, meaning that there were altogether different types of cancer. But some studies were done in a specific cancer, let's say, for example, lung cancer. And for those studies, we found that, for example, for digestive system cancer, so including colorectal cancer, for example, lung cancer, and also lung cancer, we found again the same results. So when people had higher levels of strength and cardiorespiratory fitness, the risk of dying from this cancer, specific cancer, was again lower compared to people with low levels of strength and cardiorespiratory fitness. So again, in practical terms, this means that first of all, exercise potentially can reduce the risk of mortality, but it works in any type of cancer. So this is why I told you it's safe, because it works in any type of cancer and especially any stage, because in this analysis, we had people undergoing chemotherapy, for example, we had survivors, we had patients with other treatments, and again, exercise was protective against mortality in all of them. So again, it works, everywhere,
Yeah.
in every type of cancer and stage.
Yeah. And it's a special treatment and prevention tool also because of that. It's so, I mean, the benefits, um, in terms of mortality, but also in terms of side effects of treatments. I mean, it's really impressive the range of benefits we get from tailored exercise. I would love to get into the potential mechanisms here, because I know your research is also focused on this. And let's maybe start with myokines, which is a term that we're not used to listen to. We've heard in the research and the clinical field about cytokines, but not myokines. And I was wondering if you could explain what myokines are and in which circumstances is the body producing them.
Yeah, sure. It's an interesting topic and a pretty new topic. So yeah, this came up because we found that exercise reduces mortality, but we don't know why. What are the reasons why it works? And it's very difficult to study the effects of exercise because exercise involves a lot of things when we exercise. So it has been found, let's say, 30 years ago, that skeletal muscle, so the muscle in our body, are an endocrine organs. So this means that, like other organs, they release some substances like chemicals. And one of these, it's called myokines. Myokines, in very simple term, is a protein. It's a peptide, a cytokine, but yeah, it's a natural protein. So when we exercise, when we move, when we running, when we do something in the gym, our muscles, by doing exercise, release these proteins called myokines. There are more than 600 myokines. And these myokines not only work within the muscle, for example, increasing the growth of muscle, but also they can go around the body through the bloodstream, and they can go to the brain, they can go to the lung, they can go to the bones. And of course, they give the positive effects of exercise, for example, improving bone mineral density, improving lung function, and so on. But also, from some studies, so recent studies, we found that these myokines can go to the cancer site and attack the cancer cell and potentially kill the cancer cell, or at least reduce cancer cell from growing and spreading around the body, which is what chemotherapy does, for example, which is what radiation therapy does. So this is why recently exercise has become part of cancer treatment. We call a cancer treatment, not just something to do because it's beneficial, but it's a treatment. And so, yes, this is why we are studying myokines, because we want to understand why exercise is so effective. And this can be one of the potential mechanisms. There are, of course, others, but it's very complicated to study. And we are focusing on these myokines.
Okay. Yeah, brilliant. And in terms of um, the specific myokines that are produced, and you said there were more than 600, are these things like, the cytokines we're used to talk, like IL-4, IL-10, or is it something completely different that has similar effects? Yeah.
Yes, some of them are similar. So, for example, the most studied one also for cytokine is IL-6, which is released again after exercise. But some of them are more related to myokine itself. So, for example, we have decorin. We have a lot of names. We have decorin, myostatin, which is specifically produced from muscles, spark, oncostatin. So yeah, it's a really big field. But yeah, the difference compared to cytokines, the structure is more or less the same, but the difference is that cytokines can be produced from different organs. For example, also the adipose tissue release um, chemicals, for example, adipokines or cytokine, while myokines are only released by skeletal muscle. This is why we call myokines and not cytokines, which is like a subgroup. Let's say it's a subgroup. But yeah, the structure, the molecular structure is more or less the same.
Okay. And in terms of, so they're produced by the skeletal muscle. Uh, is there any type of exercise that leads to increased levels on, I assume all types do, but is there any specific difference on, and how should we combine different types of exercise to optimize myokine production and release?
Yeah, that's really interesting because it's what we are currently doing. So we just finished our clinical trial to measure if there is any difference doing aerobic exercise or resistant exercise, and measuring what are the effects on myokines and what are the effects on cancer cell. Because also we measure, maybe we will talk later, we measure also the effects on cancer cell growth. Anyway, talking about myokines, both exercise increase myokine levels. This is what we found. This is what we know. Um, what what we actually know is that to increase myokines, we need high intensity exercise, so moderate to high intensity, but better high intensity exercise. Indeed, when we compare high intensity interval training, which is a subgroup of aerobic exercise, so for example, sprinting on the bike or something very high intensity, compared to resistant exercise, we found higher myokine levels in the high intensity interval group, in the high intensity group, high aerobic exercise group. This is just because we believe, but this is still to be determined, that high intensity exercise should produce more myokines because we recruit more muscle because of course of this high intensity. Okay. And maybe, I think everyone, if a person does 60-minute cycling or running, is more, let's say, um, it's more difficult compared to 1 hour doing resistance training. Okay. So potentially there are two different pathways to increase myokine levels, and maybe aerobic is a little bit easier. While for the
Mhm.
resistance, we need maybe also more time and more number of exercise and time and so on. But both are great. So both release myokines, and so
Mhm.
this is wonderful because
Yeah,
we can do the task
yeah,
exercise based on patient's need. So yeah,
yeah.
that's good.
And is it the case, because when I asked the question, I was assuming that, keeping your myokine levels high over time would be better in terms of sort of having an effect on cancer cells. Is that the case, that we really need to keep them high at all times, or do we just need to, have a few peaks to have sort of the same effect?
Yeah, that's a very interesting point that maybe I missed, but it's really important to clarify. So when we produce myokines, when we do exercise, we produce myokines. That's true. But within 24 hours, so within 1 day, myokines levels in the body come back to baseline. So come back to zero, let's say. So we have a peak in production immediately after exercise, and then hours and hours after they come back, okay, to baseline. So in order to induce this kind of anti-cancer effects through myokines, through exercise, we should do almost should be better every day, but let's say almost every day, this kind of exercise. It's like a drug. So if you want to reduce your cancer, you are going to do chemotherapy every week, not just only once, right? Because you need these drugs, this medication to work every week or every 2 weeks, whatever it is, or a medication that you are going to take, a pill. Potentially, they will tell you need to take this pill for your heart every day, or even 2 days, two times per day. And it's the same with exercise. So if we think about exercise like a medicine, and it's a medicine, we need to take this medicine, this exercise medicine, every day to induce such benefits.
Yeah. Okay. Yeah, amazing. Thank you so much. And I was wondering if we could explore other biological mechanisms of exercise, because, myokines is one of them, but there's also, improve um, body composition, obviously, but also, the insulin resistance. Uh, and insulin resistance is this thing that we're used to talk about in the context of diabetes, and people may be fairly familiar with that. But then when we talk about cancer, unless you're in the field, I don't think people realize it's actually part of the picture as well, and it's something that we want to sort of prevent. So, can you talk a little bit about these other benefits of exercise and these other mechanisms that sort of help with the effect of exercise?
Yeah, I mean, let's talk generally about the benefits of exercise for I mean, for the overall population, but specifically for patients with cancer. So we know that exercise, for example, as we said, improve muscle strength and cardiorespiratory fitness, can improve or preserve bone mineral density. Very important, for example, for women after breast cancer undergoing hormone therapy, because we know that unfortunately the bone mineral density decrease over time, leading to osteoporosis. Exercise can reduce fatigue, which is very common during cancer and during cancer treatments such as chemotherapy. Can decrease pain, which is again unfortunately very common. Anxiety and depression, so also some psychological domain, or sexual dysfunction and sleep disturbance. So exercise is effective, in almost every domain: physical, psychological, and of course physiological, so myokines and other stuff. And if we talk, for example, about body composition, we know that mainly aerobic exercise can reduce body fat. So, for example, again, a person after chemotherapy or wellness survivors phase can get more body weight because of the treatment, aerobic exercise, and diet, of course. But I'm the expert of exercise, can decrease body fat. And resistant training can increase lean mass, so can increase your muscles in the body. And this is important because, as I said, we spoke about what can be done by the skeletal muscle in releasing myokines. But it's really important to consider also that if we change the body composition of a person, reducing the fat and increasing muscle mass, we are we are delivering very important benefits, because unfortunately, the adipose tissue is a very strong predictor of mortality, because the more fat we have, unfortunately, body fat and adipose tissue, release some chemicals, which unfortunately promote tumor to grow faster. So let's say that if we are able to get a person fitter and fitter by reducing, for example, the adipose tissue, this person will have higher chance of survival over time and have less comorbidities. So body composition is really important. It's something that we can see, because it's not like myokines that we cannot see. But reducing, for example, modifying the shape of a person, it's really important because it can predict the mortality, especially in some types of cancer. And as you said, exercise also exerts some benefits from a physiological point of view. So you spoke about insulin, which is very studied, for example, for diabetes and obesity. So when we exercise, all these parameters that we can measure, for example, testing in the blood, can be improved by exercise. So, for example, we can decrease inflammation. Generally, a marker of inflammation is the C-reactive protein, easily measured in all blood tests.
Yeah.
So exercise can, again, decrease the C-reactive protein or other pro-inflammatory markers. There are, again, thousands of pro-inflammatory markers. And so this can help, again, the insulin resistance, adipokines, again, another range of cytokines which are involved in the tumor. So all these markers in the blood that we cannot see, by doing exercise, can actually improve. So again, the benefits are really huge also in this case.
Right. And it speaks also to me, and tell me if I'm wrong, about the short-term and long-term effects of exercise, because, in the short term, I mean, I assume as soon as you start exercising, you have myokine release in some form. So that would be very short-term benefits, I guess, in terms of anti-inflammatory factors. But then as you work out and you improve your body composition and resistance to insulin, etc., then you also drive those benefits, right?
Yes, correct. I mean, um, everyone, as soon as start doing exercise, has this beneficial effect of myokines, for example, as you said. But of course, we need to remind, and it's very important for people, that unfortunately, some benefits require time. So we can't expect to see huge changes in body composition in just 4 weeks. It's very difficult. It can happen, but it's very difficult. So we need to keep in mind that we need consistency. So at least, but it's the very minimum, 12 weeks of exercise. But I mean, exercise shouldn't stop, because the benefits can be done forever. And of course, they are good. But let's say to see some changes, for example, as we spoke about body fat or inflammation, at least 12, 16 weeks of course, we have greater effects if we couple with a diet, for example, and also psychological support, because we know also that this may play a role. So yeah, the more we get from exercise, the more time we spend, the benefits will be greater, of course. But yes, we need to keep in mind it takes time. It takes time, yes.
Yeah.
And also, apart from the duration, so we're talking about 16 weeks, the consistency within the same week is very important. So every week, 3, 4, 5 sessions per week, and keep this pace for 16, 20, 24 weeks makes the difference.
Yeah, absolutely. Yeah, consistency. That's something we're also bringing to our appointments anytime we talk to someone about exercise. So yeah, absolutely brilliant points. And in terms of the effect in hormones, so that's another issue that I'm particularly interested. As you said, this is we see lots of people, women with breast cancer, and sometimes regulating the side effects of treatment it's a challenge for us, but especially for them. So can you tell us a little bit about the role of exercise in terms of the impact it has in our hormonal system, and if you can as well, because you touched on I assume the benefits in terms of psychological support are also related with the cortisol levels. And yeah, so if you could talk us a little bit about hormones and the role of exercise in regulating the hormonal aspects in the body.
Yeah, definitely. It's a really key point because uh, unfortunately, we have, I mean, the most diagnosed cancer apart from lung are prostate and breast cancer, and it's also the leading cause of cancer death for women, for example, breast cancer. And one of the most common treatment after the main treatment like surgery or chemotherapy is hormone treatment, hormone therapy. This is both for prostate cancer, for example, androgen deprivation therapy, or for women after surgery or chemotherapy. So it's very common. So we see a lot of women with this treatment, and of course, they unfortunately to date it's very important to get this therapy, but they have some side effects, of course. And so we see, for example, increases in body weight and body fat, especially loss in bone mineral density, definitely loss in physical functioning, very problems in trying in sleeping during the night, which is another key point. So then we have anxiety, maybe depression, so a lot of things. And this is because hormones are really important in the body. So hormones are regularly produced by the body. It's a natural production of the body, but they need a balance within the body. And because some breast cancer types, the majority I would say, and prostate cancer or other type of cancer, they are hormone sensitive. We need this kind of hormone therapy to try to prevent cancer to grow and because of these hormones. And the good thing is that even for women or men undergoing hormone therapy, exercise is really beneficial because can um, let's say improve. It doesn't mean that should increase or decrease the hormones, because every hormones, every cytokines has different, let's say, direction. Sometimes it's good if they increase, sometimes it's good if they decrease. So we can't say it's better to increase or decrease. Okay.
Right.
So when we exercise, we know that exercise can regulate hormones in the human body, so estrogen, testosterone, and others. And it's really important because this is why exercise can also be called adjuvant therapy, because it helps in this case hormone therapy to better regulate the hormones in the human body. So this is why we should exercise even during treatment. And this is really super important, especially for women and men undergoing hormone therapy.
Yeah, brilliant. And in terms of the cortisol, it has a similar effect like the regulation of
Yeah. Yeah. So
hormones.
yeah,
Yeah.
apart from the benefits that we spoke about, exercise it's really important because can regulate, can bring the body to a new homeostasis. Homeostasis can be reached at different phase of the disease, in this case of cancer, but sometimes can be, let's say, a wrong homeostasis. So we need to put it back. And exercise is an important regulator, because apart from doing some benefits, can regulate the human body, because human body by nature should move, should exercise, because
Right.
we are not made to sit all day and eat junk food. We are made by, walking, doing activities, eat fresh food and good food, healthy food. And so exercise regulate and restore all the function, including, for example, sleeping, help people in sleeping. So it's an important regulator also for the cortisol. So yeah, I can't find a medicine that can deliver such amounts of benefits, because we are talking from the bones to the cortisol to the lung to the brain to the cancer cells. So it's everywhere. So
Yeah.
there is no purpose not doing exercise, especially for
No,
people with cancer.
that's right. That's right. It's quite impressive. And you touched on that a little bit as well, but obviously combining exercise with other modalities, and I'm talking specifically about nutrition here, it seems to sort of potentiate the effects. So it's is it the case that the effects are added to the diet, or is there like sort of a exponential uh, increasing benefits if you combine both?
Yeah, well, that's a good question. I'm not an expert of diet, of course.
Yeah.
We work with dietitian. I read stuff about diet. Let's say that they go in the same direction. Just my honest opinion, I could be wrong, but from my understanding of the literature, it appears that the benefits of exercise are a little bit greater than diet. It appears. I could be wrong, but
Yeah.
it's not a competition, just to say that. So we know, for example, if we want to improve muscle mass in a patient, we know that doing more resistant exercise is better than doing aerobic, because we need to build muscle. And in this case, protein supplementation is really important, because this helps muscle to grow. So let's think about a person very lean, maybe they with sarcopenia after cancer treatment, for example, lung cancer. So we need to build muscle up, because we need this person to get stronger and stronger. Or in the other way, if we have a person with overweight or obesity, aerobic exercise, of course, is better, because we can burn more calories, so we can reduce more the body weight and body fat. And in this case, calorie restriction has been seen to help, of course, in reducing body weight. So again, it's a different approach compared to the previous one. So again, they work together, they help each other. And so, yeah, it's fundamental to, have a very wide approach when talking about cancer. It's like when a person with cancer is diagnosed, the clinician go with goes with all the treatments available. So it can be a combination of surgery plus chemotherapy, or chemotherapy, surgery, and chemotherapy again, and radiation therapy, and then hormone therapy. So it's the same with exercise. So we should apply everything. So exercise, for example, diet, psychological support as well. So everything that can really help a person.
Right, absolutely. Um, would love to touch as well on advanced exercise modalities that you're interested in. And
Yeah.
I've seen a few in your articles, and I would love to get to know them, because I think they're sort of foreign for many people as well. So maybe let's start with eccentric training, and the role of something like eccentric training um, or maybe let's start with actually exploring why advanced exercise modalities. I think that's probably the first question. And because, we have all these different modalities that we discussed already. So, what's the specific benefits of these advanced exercise modalities?
Yeah, definitely. So we came up with these advanced modalities because, first of all, we should really highlight that gentle exercise is not exercise medicine. So can be helpful for any reason, but if we want to deliver changes as we said, psychological, physical changes, we need a certain level of intensity and volume, okay? So not every exercise is a medicine. A specific exercise, and in this case, it's moderate to high intensity, can drive the benefit. So we came up that sometimes just the traditional resistance anaerobic exercise cannot be enough. And we came up with this idea because in other clinical population, let's say obesity or let's say cardiovascular disease, we are really using advanced modalities of exercise because we know that they can induce greater effects. And so we came up with this idea and saying why we cannot apply the same framework, the same idea of these advanced modalities also to patients with cancer. Why not? So this is why we came up with this paper. And in regards to eccentric training, for example, so eccentric training is a resistant training where a person try to slow down the eccentric phase. So instead of doing 1 second concentric, 1 second eccentric, we can do 1 second concentric and 3 to 5 seconds eccentric. So this should.
Sorry, Francesco, can I just ask you to define those terms? Because I'm thinking that many people would not be familiar with eccentric and yeah.
Okay. So let's put very simply. So when we do, for example, a chest press or a squat, okay? So we do a movement. We go up and down or down and up, okay? So the concentric phase is when we push something away from us, okay? So let's say talking about the bench press, so the barbell. When we push a weight, this is the concentric phase. And when we come back to our chest, this is the eccentric phase. So generally, as you see people doing workout in the gym, they do 1 second pushing and 1 second coming back. Same for the squat, 1 second to sit down on the chair and 1 second to stand up. And you do multiple times, okay?
Right.
Eccentric phase, we are trying to slow down just the eccentric phase. So for example, talking about the squat, let's think about a person that stand up in 1 second, but instead of sitting down in 1 second, this person has to slow down this movement and take 3 or even 5 seconds to touch the chair. So to actually sit down. Or the same with the chest press, 1 second pushing, but before coming back to the chest, 5 seconds slowing down the barbells in this case. So this modality potentially increase the gains in muscle strength and muscle mass because we have more time under tension of the muscle. We can have greater anabolic response from the muscle. So there are a lot of physiological reasons. And also we have a lower metabolic cost. This means that if we compare the volume of exercise between traditional exercise or eccentric, if we do eccentric, the metabolic cost is lower, but we have greater benefit. So it's a good modality. And this, for example, we propose this modality, for example, for people who need to increase more muscle mass and muscle strength, because it's a good way to build up muscle over time instead of just doing traditional resistance. So for example, this was the eccentric. If you want, we can go through another one, or you want to? Yeah.
I was just going to ask. This modality seems particularly interesting. I'm thinking about people with advanced cancer, for example, where the metabolic cost of things, and especially when we talk about conditions like cachexia or the potential to sort of have an increased catabolism is so high. Would this be something that would suit someone with advanced cancer and these conditions?
Yeah, definitely. Because I think that this modality is definitely can give greater benefits to people, for example, with sarcopenia or even with cachexia. For example, as we talk about which kind of exercise should I give, a person with cachexia should just focus on resistance exercise. This person shouldn't do aerobic exercise because they are already losing fat and muscle mass. So we need to build up the body weight and the muscle. So, for example, eccentric training should be a good choice. So yes, and also eccentric training is good to promote bone mineral density, because bone mineral density can be improved, for example, by doing some jumping activities. but also, but sometimes can be difficult. It depends on the patients. Elderly patients, it's difficult that they jump. Okay, but traditional resistance training or eccentric, because of the tension that you have over time and the load, so the load that you can put in your exercise can stimulate bone, and so the bone
Right.
can be preserved, or they can even improve. So yeah, definitely it's more suitable for this kind of population. Or for example, another population who can benefit from eccentric is survivors. So survivors maybe are already accustomed to exercise because they already went through the treatment. They are recovering well, let's say 2-3 years after the treatment, the surgery. So they are feeling well, let's say some people around 45, 50 years old or even younger, and they want to increase more uh, their health, their physical health. We can do something more advanced because we know that they can do more because they are still young, they are going very well. So we can, for example, give them eccentric.
Right. Brilliant. Okay. And yeah, please go ahead and tell us about the other modalities because I'm very curious to
Yeah.
know about them.
Yeah, the second one, which is I think is the most interesting one for patient with cancer, is called cluster set training. So we are talking again only within the field of resistance. So again, when you go to the gym and you see people training or you train, you generally do, for example, 10 repetition, let's say, or 12 repetition. Then you rest a couple of minutes and you do it again. Okay, these are called repetition, 12 repetition for 3 sets, 4 sets. Okay, some colleagues in sports field found out, and this is why we took cluster set training, that if you split your 12 repetition in 4 repetition, 20-second rest, 4 repetition, 20-second rest, 4 repetition, the total is still 12 repetition, but you have a very little, very quick breath, very quick rest, just 10, 20 seconds. This should help to increase the load that you can put in your machine or barbell, whatever you are using, but also help to dissipate fatigue. This is why they use in athletes, because athletes that has to perform every day, of course, fatigue is a matter of very important. Okay, so we thought why we can adapt this to patient with cancer. We know that one of the main issue with patient with cancer is fatigue because of treatment, because of cancer itself, and so it's a very important issue. So by doing this kind of very short rest repetition, we are helping patients to dissipate fatigue. And this is very important because sometimes patients cannot adhere to exercise because of fatigue. So then they feel like sad, they feel like in a discomfort because they cannot accomplish with what we act for. So also to stimulate their adherence to exercise program, giving them the feeling that they can do it, they can make it, dissipating fatigue is really beneficial. And then through exercise, we can then improve fatigue over time. So this is, yeah, it's really simple. There are different schemes that can be used. So it can be, for example, 4 repetition, 10 seconds, 4 repetition, 10 seconds, 4 repetition, or can be even 2 repetition, 10 seconds, 2 repetition, 10 seconds, and so on. So there are different schemes that can be used. We spoke about that in our paper. But for example, in this case, compared to resistance, I think it's very suitable for people with severe physical deconditioning, or for people with severe cancer-related fatigue. For example, let's say lung cancer, which struggle with exercise because of after the surgery, for example. So during chemotherapy, or this kind of situation, I think that dissipating fatigue is the main aim. We just want people to deliver exercise. We can't ask them to perform their best workout ever, definitely. So, and this is why I think it's a really interesting modality for patients with cancer.
Yeah, absolutely. That sounds. I mean, even psychologically, I assume people can do more if they think about doing 4 repetitions instead of 12. So
Yeah.
it's yeah.
Yeah,
So
also mentally can help because you know that you are doing just 20 repetition, you rest 20 seconds, or
yeah.
repetition, you rest 20 seconds. So yeah, I think it's really interesting. It should be employed more, and it's a sort of traditional resistant training, so it's nothing that can compromise the effects of exercise, or can be harmful. definitely.
Okay. Yeah, beautiful. And so the other modality is the blood flow resistant training. Is that it?
Yeah, blood flow restriction or blood flow resistant training. So yeah,
Yeah.
this is we should be cautious on this because as I wrote in the paper, this has been studied only once in cancer settings, so we can't recommend doing blood flow restriction. So because of this, so blood flow restriction, you put a tourniquet or a specific device on your upper arm, for example, at the bicep site, or lower limb, for example, quadriceps site, because by restricting your upper arm or your lower limb, because of there is a restriction in the inflow and outflow of the blood, we can induce hypoxia. And because of hypoxia, it appears that muscle can grow quicker compared to not
Right.
having this kind of device. Unfortunately, this kind of device is safe, definitely, but we need to go through some recommendation, because of course we can have some circumstances, for example, cardiovascular disease, where we cannot occlude arterial inflow and venous outflow, of course. So this is why we should be very cautious. We propose in our manuscript, in our paper, to have more studies investigating this, because can be very helpful to have this modality to easily help muscle to grow. But unfortunately, there are no studies. So we are asking for people, for researchers in this case, to run studies. When we will have more data, we can safely say, yes, it's beneficial, or we need to pay attention. So at the moment, again, I can't recommend using, but it's something to keep in mind, because we know that the field of exercise oncology is growing faster and faster. So it's important to see what can be um, the next achievement that we can get from exercise. And again, this comes again from sports field. And so, yeah, this is very interesting again, but again, we need a little bit more time.
Yeah, absolutely. And you're doing already a super great job with all the research you're putting out there. And I was wondering if you could tell us in your mind what's the future of exercising cancer, and I'm talking specifically about the field of exercise research. So what would you like to see or perhaps do and publish in the next decades in this field?
Okay. I think in my mind, and I think it's one of the most interesting topic. The first one is investigating the effects of exercise in people with bone metastasis, which is unfortunately a very difficult condition to treat, because people are very fragile when they have bone metastasis. But I assume that something can be done in terms of exercise to try. You can't say to improve the bones, but to preserve the bone. You know what I mean? Because sometimes a good achievement is already preserving and not losing. So we can't expect from an older person to increase the bone. Let's say 80 years old. We can just trying to preserve the bone. Okay, so this is one for me of the main topic, but the real one, in my opinion, the second one, the most interesting, is to actually find if exercise can kill the cancer, and then consider exercise a true cancer treatment, and not just a adjuvant therapy like diet, or like psychological support, or any kind of really important, let's say very important, this kind of treatments, but not a core treatment like surgery or like chemotherapy. So it's a very difficult research to do, because involve people, involve lab analysis, very expensive, very difficult. We need a strong collaboration between exercise people, researcher in exercise, and researcher in the lab. So people who know about how to run lab analysis, because it's a different field. But yeah, the next bubble for me will be to find out if actual exercise can kill the cancer. And this is what we are trying to do. We are far away from that answer because of the lab analysis we are doing. So we found evidence that exercise actually reduced the cancer cell growth, but because this was still in vitro, in lab analysis, we can't say that we are sure about what's happening in the human body, because in the human body there are organs, blood, a lot of things.
All the other factors. Yeah.
Yeah, so this is still a lab analysis, but the pathway, the journey should be to go there. So let's see what happens actually in the human body in doing exercise in terms of cancer cell. It's a very long journey, but I think will be huge. This is for me the key point, because I mean the main outcome for a person with cancer for me is to reduce the mortality. That's it. I mean, not that's it. There are a lot of comorbidities, but the most important one, we are talking about survival. Of course, it's important to increase physical and psychological outcomes, but if we are able to reduce the risk of mortality, we are giving to people more time to live, or even kill the cancer, maybe, like sometimes happen with chemotherapy. So this will be for me the next huge step that I hope to try to get it.
Wow. Yeah, that's a huge step. But
Yeah.
the results you have so far in the exercise tool are so promising that I mean, why not going there absolutely with less with absolutely less side effects and impact on negative impact on people. So yeah, that's fascinating. Francesco, we're coming to the end of the episode today, but I would love you to, I don't know if we missed touching on some key points that you think are very important, and if you have any last messages for us in terms of this approach with exercise in people with cancer.
I think we said almost everything that is important for me for the field of exercise for people with cancer. My last quotation is coming from my professor, my supervisor, and he says that uh, exercise cannot be fun sometimes, cannot be pleasant, but neither chemotherapy is fun. But even if it is not fun, we are taking chemotherapy, of course, and we need to. So exercise should be a must have, shouldn't be like an adjuvant therapy, should be a therapy to must do, because it's actually a cancer treatment. So we should change the narrative. We should change how we see exercise. Should be a core part of cancer treatment, like chemotherapy, radiation therapy. We are not saying that it's better or we should avoid any other kind of treatment, but we work with them, together with them. But yeah, exercise, it's not something that should be pleasant. It's something that should be done, like chemotherapy or surgery or whatever it is. So I think it's really important if people and clinician and healthcare professionals switch their mind on this point, because then we can also change the policy of exercise as treatment, for example, within the national health system.
Yeah, absolutely. Thank you so much, Francesco. It was such an interesting conversation. I learned a lot with you. And it was wonderful to have you on the podcast.
Thank you so much for inviting. It has been a pleasure. And yes, reach me out if you need any question. I'm sure you will tag me. So yeah, I'm really happy to talk with clinician or researcher. It's really good to.
Absolutely.
Thank you so much.
Absolutely. We'll put all the information below. So for now, I say goodbye to Francesco and goodbye to you. Thank you for listening, and I'll see you in another episode later down the track. Thank you.